of any one of these is a thing called procedure. And that's a grand name for it and so on. But really what it comes down to is it's a delay. Okay? You can see it's represented as a delay. And in this case, the delay has a time associated with it that's not fixed. It's drawn from a uniform distribution between 0 and 10 is what they have it. And it also, you'll notice, has a capacity of 5. That means there's only so many people that can be queued up here kind of awaiting this, or in this procedure, I guess I should say, or are currently undergoing this procedure at the same time. And if there's more than that, well, it'll sort of run out of space for them. And you can see that you can override that and have a maximum capacity. You just have as many as possible. Okay, so what I'm going to focus on now, so those are a couple of these, the source, sync, network, enter, select, output, and delay. Split I'm not talking about. Basically with split you can have a given entity, now this sounds ghostly, but you can have an entity turn into two entities and flow down two parallel procedures. And those might represent, like, if they're being, like maybe someone is having their blood examined in the lab while they're undergoing radiological testing. Or maybe, you know, they're being hitched up to certain types of support equipment at the same time something else is occurring with them. So they're conceptually both are occurring simultaneously, and then they'll probably merge together back later. What I'm now going to talk about, though, is a set of things that are somewhat more difficult to appreciate, but I'll try to do my best to relate them to resources. They all have to do with resources. So I've mentioned we have these entities. They're flowing through, and sometimes resources are needed for tasks. So to be admitted, the triage nurse has to see you. To stay in a bed in the ER room, a bed has to be available. To be imaged, an X-ray room, an X-ray imager has to be free for use, etc. So those are resources, and how do these entities interact with these resources? How does an entity claim or reserve a resource, and how do they go to the resource? How do resources like doctors accompany the patient, etc.? That's what we're going to be talking about now. Okay, so I did this. Let's talk about resources. Okay, so we talked about these types of resources. An agent will try to obtain a resource, and we use the term seize a resource. And if they can't, they're in queue. They're waiting. Okay, so these resources live in pools of interchangeable resource units. A seized resource comes from the pool. A released resource returns to the pool, and these agents will try to seize resources to be able to undergo some procedure, for example. And suffice it to say that, like, if you have clinicians who differ in some respects, like maybe a patient always gets paired up with the same clinician, the way you do that is by representing them in different pools. Okay. Okay, so let's look at our model here, and I'd like you to go to main phase. If you could just go to main phase 2, just so you stay consistent with the model. You'll notice main phase 1, 2, and 3 all have some similarity, like the similar diagram, some components, but they're getting successively more features as you go 1, 2, 3. Okay, so I'd like you to click on, so you should see something like this in front of you, okay? So there's a couple of things here to draw your attention to. We said already that the network is associated with resource pools. However, there's further a thing called network seize and release that are here, and seize will seek to achieve exclusive association of an entity with a resource. Basically, the entity will try to reserve a resource. Okay, so this entity coming in here wants to go to a procedure room. It needs to go to a procedure room to be examined, let's say. Be examined in this procedure. In order to do so, that entity needs to reserve one of those rooms, so you don't have multiple entities going to the same room. You know, you don't have multiple entities in the same procedure room, which is not going to happen, and without capturing this mutual exclusion, you're going to be missing some of the aspects of congestion in hospitals, why there's people waiting in hospitals. So before the person moves to the procedure room, they're going to try to reserve that resource, okay? And then later, they're going to release it. After the procedure, they don't need that room. They're going to leave that room, and they're going to release it for use by other patients, okay? So seizing and releasing conceptually is how an agent is going to uniquely reserve a certain resource, okay? And what we'll see is that those are the first two of a number of different kind of verbs, as it were, that we use in this to describe people's relationship with resources. These are probably the most important two, because they have to do with uniquely reserving a resource, okay, on the part of an entity. We're going to see there's other components having to do with moving with the entities and so on, but seizing and releasing is all about reserving these entities, okay? There's a separate distinction from seizing and releasing that have to do with attaching and detaching. Seizing and releasing have to do with uniquely reserving a resource, uniquely being associated with a resource for some period of time. Attaching, detaching is all about will things spatially follow the agent. Things that have already been seized by the agent, will they then follow the agent physically as they move through the system? As they move through these paths within the system, will the resources follow them or not? For example, you might seize a doctor. This sounds transgressive, but put aside the sort of meaning of it. So you might seize a doctor as an entity, and that doctor is then uniquely reserved by you. They're associated with you uniquely for this period of time. And as you are routed among the facility, that doctor might travel with you. You are not attached to something, but you can be sent to a place, okay? And we'll see how that gets done. But even when that occurs, like you might be sent to where the doctor's home office is, for example, and the doctor will go with you because they're attached to you, okay? Yeah, so seizing has to do with logical association, with reserving them uniquely. So there might be a doctor who's sitting in their office elsewhere, and they're seized by you in the sense that they're dealing with your case, but they're not physically with you, right? Similarly, there might be a procedure room that you've seized. It's booked in your name, but you're not there yet, okay? Attaching has to do with you physically stay with that thing. And this is for non-static things. So in other words, non-fixed things. Things that are either mobile, like doctors that move with you, nurses that move with you, or portable, a scope, a portable ultrasound machine that travels with you, a wheelchair. It travels with you wherever you go, whither thou goest. Yes?
So, why is the distinction necessary? Because let's say there was a machine that was following you physically. You could always save that machine at some point and release it at another point.
Yes, you could. Okay, so there's a distinction because there are all four, at least three possibilities are possible. So you can imagine a case where I've seized something, but I don't want it physically to be with me. For example, I'm associated with a scope has been reserved to my name, or a room has been reserved to my name, but I'm not yet there physically, right? Okay. A doctor has been reserved to work on my case, but they're still in their office. However, there's other cases where I do want to say, okay, this doc is following me around wherever I go. This nurse is following me. This scope is following me. It's something I'm carrying with me, or that's a wheelchair traveling with me. Either of those are possible. You will have cases where you have reserved things, and through seizing, and they're not attached. You'll have cases where you've seized, they are attached, and alternatively you'll have cases where you haven't seized them, in which case the attachment is not an issue at all. So it only becomes an issue when you've seized it. And it provides you an extra measure of flexibility as to whether it travels with you or not.
Because otherwise it has to be found endpoints.
Yeah, it would basically lead to more, you could do it without it, but it would lead to more clutter, because you'd have to kind of direct around, whenever you direct the patient to a place, you'd have to direct the doctor to the place.
Right.
And this allows it to just follow directly. It allows you to have the scope go with the patient without extra description of it. And the patient can move among many places, and all those things follow.
But is it only for visual